Hello, everyone. Welcome
Not like it. Just a minute.
my name is Councilman Lightfoot. Welcome to City Council work session. We have a work session. As you can hear, my animals are in the back. And I think that's very germane to our conversation today, even though we're not talking dogs, we're talking cats. However, we do have Chris Fitzgerald is with us today. And we're going to, along with rest of our colleagues and staff, we thank you for joining us this afternoon. And I would ask if Chris Fitzgerald, if you would take over at this point and share with us your presentation, sir.
Happy to do so. Usually, thank you, Vice President Lightfoot. Usually I'm the one that has to make apologies for the animals barking in the background. So that was a nice treat. I'm gonna, let me start by saying thank you for the opportunity to explain what we're doing at Animal Services in Rochester and address some of the concerns that have arisen. We're not refusing to accept cats. It seems that there's been some miscommunication about what we're doing and what changes have been made and maybe the reasons behind them. And whether that's through some sort of misunderstanding or miscommunication, I'm not sure. Maybe it's a combination, but regardless, that misconception has permeated. So I can say that everything that we're doing is focused on trying to provide support for people and animals. However, that support may be coming in different forms than it came previously. It's understandable that our community may be confused because for decades, animal welfare organizations, us included, have been telling people that to bring us their unwanted pets. And we'll find the solution. We'll be the solution. Now we're saying that there might be better options. Shelters have always been inherently stressful and unhealthy places for animals. That's nothing new. But the messaging around it now is a bit different. We're trying to be transparent and let community members know that although the shelter is here as an option, that it is an option and it's a resource that should be reserved for the most at-risk animals. And it's about trying to be more efficient and find the best outcomes for as many animals as possible. So instead of telling people to bring animals to us, we're asking if folks might be able to hold on to the companion animals and we'll provide some sort of support. Are we able to intervene or provide some support that enables a pet owner who's struggling with keeping their pet to keep it? Or maybe rehoming it, placing into a new home is the best option. Are they able to hold on to that animal for a period of time while we assist them in finding a new home, thereby ensuring that it stays in a healthy home environment and doesn't occupy space at an animal shelter needed for other at-risk animals? Or maybe it's someone who's found a pet outside or an animal outside, and we're able to ask them to be involved in reunifying it with its owner. If people are unable to do those things, we take the animal in. As for community cats, the entire industry is taking a really hard look at whether intake of healthy cats is the best option for these animals. If they're thriving where they are, based on the body condition, its appearance, its overall health, perhaps the cat would not be best removed from the area. So in such cases, we're trying to connect community members with local trap, neuter, vaccinate, return organizations, groups that we have partnered with for years. In some cases, we're offering the spay, neuter, and vaccination and other resources ourselves. Much of what has changed for us and for our industry is related to the Human Animal Support Services movement. So, so before going into, I've got like 5 slides that I was going to go through with you on community cats. But before going through those slides, I'd like to share my screen, play a brief overview video of what the HAAS movement is about. And I'll stop it before it ends because it just gets into specific resources that are available for partnering organizations like Rochester Animal Services. So then I'll flip to the slide deck. So bear with me while I share my screen. And I'll play this video.
Hello and welcome. My name is Bobby Mann. I'm the Maddie's Human Animal Support Services Pilot Director, and my goal over the next 5 minutes is to give you a high-level overview of HOS and introduce you to our learning community. To start, what is HOS? HOS is a collaborative project fueled by the animal welfare industry to create an entirely new way of serving pets and people in our communities. If you were to ask what our top 5 goals are for HOS, I would tell you create and lead a collaborative movement to build community-centered animal services, position equity, diversity, and inclusion at the heart of animal services work, use evidence to drive and support community-centered animal services, incorporate the HOS elements into the communities everywhere, and to change the laws and ordinances and regulations to support the successful implementation of the HOS elements. To give you a very high-level overview of who is involved in HOS currently, we have 38 pilot shelters from all across the country, 35 individual working groups that have been created to solve long-standing industry problems, over 700 industry professionals from all over the country, all the way from CEOs to frontline staff helping us in those working groups. And in just the year 2020, the HOS project helped facilitate over 800 hours of animal welfare meetings for professional development and to help drive the change toward community-centered shelter. The collaborative has over 409 organizations that have been signed up. Our Tier 1 organizations represent over 18 million community members that they support. There are 31 universities and learning institutions involved, and over 440 organizations that are signed up through our learning community that touch all 50 states. If you were to ask what HOS truly is, it's really defined clearly on this graphic here. So as you can see at the center and the core, it really drives from diversity, equity, inclusion, government support, research and data, and innovation. Surrounding that, you can see our essential elements that we believe will help change and guide organizations to community-based sheltering. Those can range from lost and found without a kennel, foster programs, partnerships, case management, field services, public safety, and many more. And as you can see, what truly surrounds that makes HOS successful is partnerships with our communities to help create programs that will allow self-serving, but also great partnerships to help people and pets where they are. Why is everyone joining HOS? Well, because it's not only helping pets, it's helping people. It's the first large-scale change that we're trying to really get to the root of the problem. The goal is to empower everyone to be a part of the solution. And as we mentioned earlier, we really want to focus on making D&I the heart of animal services. This quick graphic will show you a visual of where all of our pilot shelters are located. And as you can see, it's a very diverse group of shelters geographically, but also by the type of organization, as nonprofits with government contracts, as well as government and municipal agencies. The big picture plan, 2020 HOS was formed. 2021 is to create and disseminate comprehensive elements toolkits, which you will be a part of. We're going to create 3 to 5 research projects in 2022. And in 2023, it will be a broad expansion of everything that we've done successfully with the HOS project.
Okay, so I'm going to stop sharing that right now and switch over to my slides. Okay, do you have a graph on the screen?
Yes.
Thank you. Spoiler alert. That was the second slide. So, so specifically, I know you've received concerns and questions related to community cats. So I thought it'd be helpful to start off with some explanation.
First, I just want you to be aware that we can see your narrative also. I don't know if you meant for that to be that way.
Hang on a second.
There you go.
Got it?
Yes, sir.
You have the full slide?
Yeah, you may have to hit that little thing to make it one full slide if you want, just to increase it.
I think I still have the
That little arrow on the bottom next to the negative button. Go down, Chris, to the negative, yeah, over to your right, and the little screen right there next to the negative button. Hit that, not that one. Move over. Next to the negative, right there. Click that.
Yeah, I think it's on my, sorry, everyone. I think it's on the wrong screen.
Oh, okay.
Screen 2. Let's try this.
Oh, there you go.
Perfect.
Yep.
Is it up now? Do you have the full?
Yes, sir. It looks, it's
Okay.
a full screen.
You're good.
Sorry about that. Okay, so the definition of what a community cat is. So this isn't a new term. Community cats, it's a well-established term that has been used in animal welfare for 10, 15 or more years. But it can be confusing. It's a broad term that's used to define or classify cats based on where they're living. Has nothing to do with their temperament or behavior or anything like that. So community cats are typically a combination of unowned or loosely owned cats that are comprised both of strays, which are lost and abandoned former pets, that might be friendly and socialized with people, but also it includes feral cats that are ones that have not been socialized with people, that live entirely outdoors, generally are fearful of people, and do not make good candidates for placement in indoor homes. It also includes all of the offspring of both the feral and the stray cats. The best practice recommendations that are also well established have included trap, neuter, vaccinate, return for again 15, 20 years or more, and then more recently, maybe over the last 5 to 10 years, return to field programs. So the difference between these two approaches is really one about logistics of who's involved and who takes the primary lead, but they're both based on the premise that we want to sterilize and vaccinate the cats that are in our community and not allow them to continue to reproduce unchecked. So TNVR, trap, neuter, vaccinate, return, is led by grassroots individuals and organizations that are responsible for the feeding, trapping, and transportation of the cats to and from partner clinics that provide the medical services. And so some of the groups in our area we've been working with for the 20 years that I've been here, nearly 21 years that I've been here. Return to field is a different strategy. It's implemented by shelters themselves, and it's more reactive. So shelters, in looking at cats coming into their facilities, are considering what's the best options for the cats and ensuring that there are the best possible outcomes for them. So in some cases, placement into a home, an indoor home, might not be an option. And in such cases, returning the cat that came in as an at-large or stray cat to its capture location or its found location may be the best option for those cats. So we're following these best practice guidelines. We are accepting cats, but what we're stopping is we're stopping the indiscriminate intake of outdoor cats, because again, we're focused on best possible outcomes. So speaking of outcomes, this graphic is this is RAS here in Rochester statistics over the last 5+ years, including partial for the current fiscal year that we're in. Return to home, RTH, is a metric that shelters have been using for forever, and it's it's looking at how many of the animals that come in go back to owners. Now, for way of comparison, the return to owner rate for cats nationally is ranges from 2.9 to 4.5%, depending on whose statistics or whose numbers are involved. So we're operating in line with what's happening nationally. But the numbers for dogs range from like 30 to 50%. And in Rochester, they're upwards of 50% for returns of at-large dogs to their owners. So this doesn't mean that we're behind the industry. It means that the industry has been doing the wrong thing, or has focused its attention on the wrong thing with regards to cats. Bringing cats that are either unowned and have no owner to come find them into shelters where they have to be held for a period of several days, and then having limited options for their placement depending on how the animals present, their medical conditions, and then vying for limited spaces in indoor homes, but also some animals that may be owned, that owners either don't have access to transportation to come to the shelter to look for them, don't have access to the internet to look at the listings of animals that came in as found animals in our community, or maybe they allow their cats to roam indoors and outdoors, like 50% or more of cat owners in our country do. And so they don't even think to go look for the cat, because it's not uncommon for the cat to be on, walkabout for a few days. But many of these cats are truly unowned, or maybe loosely cared for by neighbors in the community. So looking at doing things differently. Cats are reportedly 13 times more likely to be reunited with their families by means other than a visit to the animal shelter. And most commonly, missing cats return home on their own, or are found by either the owners themselves or neighbors or family members that are in the neighborhood assisting with searching. Specifics of what we're doing here at Rochester Animal Services: we've shifted to more of a triage protocol for intakes, and so we're trying to engage in a conversation with community members and partner organizations to find out as much information as possible before deciding whether the animal should come in or not. But intake remains the default option. So when having those conversations, we explore the options if the caller is unable to assist with reunification or to hold on to the animal temporarily, the animal would be coming in. We do provide a variety of tips and guidelines for assisting with reunification. They're on our website. We have handouts. All of our field services folks and our call takers have the same information and resources. So regardless of whether we encounter someone out in the community or on the phone, they should all be armed with the same tools in their toolbox. The goal is really to try and limit intake of animals to the ones that are most at risk, the animals that are in most need of our services, which are the sick, the injured, the animals that are known to be abandoned or that are otherwise at risk because of some sort of crisis, like coming from a domestic violence situation, maybe a demolition where the cats are now without a home, an indoor home that they previously had. Or maybe they were pets that were owned by a person who is now being hospitalized or has passed. So deceased owners, that had indoor pets. Their pets need an indoor home, and those are what shelters are really trying to focus on. Is like the animals that are really the most at risk that need our services. We're trying to avoid removing cats from their homes, which includes cats whose homes are outdoor. So not looking at homes, the word home, from the traditional sense of an indoor home. Additionally, we're trying to get away from removing cats from marginalized communities, and frankly, from taking animals from Black and brown neighborhoods and placing them in middle class and upper class white neighborhoods in the suburbs. And, at least 50% or more of our adoptions are outside of the city of Rochester on an annual basis. So really, this is tantamount to taking cats and from communities of color and placing them in white communities. Some of the other activities we're involved with is we continue to support our trap, neuter, vaccinate, return partners, either by providing the spay neuter here or by referring callers, people who find animals to those groups. We're trying to engage community members in the process, so get them involved if they're interested in being trappers or caretakers for those animals. We don't have a formal return to field program here yet. That's why there's a question mark on the slide. It's something that we've been exploring for the last few years and haven't implemented a program yet. We're trying to figure out what that would look like for us, develop what the protocols would be around it. So that's something that is in the works and up for discussion among my team, but something that we believe is going to be part of what rolls out in the future. And then, trying to support those caretakers in the neighborhoods. So either that we're identifying the folks that are already there that are providing care for the animals, and these might be people that are just monitoring them. They might be feeding the animals. They might be allowing them to take residence under their porches, or they might be providing some sort of shelters for the animals. But trying to identify those community members that are already involved or recruiting new ones, and then what ways can we support them? And that might be through assisting with food and giving like responsible feeding guidelines so that you can feed the cats, but without encouraging nuisance wildlife to come to the locations. Things like how to construct do-it-yourself shelters for the winter, or even providing the structures, because we've got scout troops that are interested in building them and making them. And then beyond that, things like feeding guidelines or bottle feeding guidelines for kittens, if kittens need to be taken in and cared for, so that they don't end up in shelters, and any kind of support that we're able to provide. This graphic is an example of what also lives on our website. So we have a similar graphic that has been on our website for a couple of years. We got ours from the San Diego Humane Society, but these aren't uncommon. There's lots of similar examples out there that are guides for community members to use, so that when they find cats outside and have concern, this helps with recognizing whether the cats need intervention or not, or maybe just monitoring, or maybe in some cases they actually do need to come into the shelter or receive some sort of care. In general, it's about looking at the age and the condition of the cat. If the cat has a good body weight, good coat condition, seems to be thriving where it is, then maybe it doesn't need to come in. But what can be done? And so it's trying to provide some other ideas for how the finder can assist with either figuring out if the animal is owned or figuring out if it has a caretaker in the area. That can be by suggesting that they post something on a neighborhood site, whether that's a Nextdoor app or maybe there's a neighborhood association listserv. Asking neighbors if anyone's missing the cat, or posting a flyer, posting something in again on that listserv or through one of the many online platforms for posting missing animals. We can check our lost flyers and reports here at the shelter to see if it's a cat that someone has reported missing and it seems to match. Some communities are providing paper collars where people who find outdoor cats can write a message on there saying like, is this your cat, or is this a community cat? If so, please call me. So then the finder and the caretaker or owner know where the cat is and who's caring for it. These are all things that we can do. We can encourage to help with the triage of whether or not this is a cat that has people caring for it, whether that be an owner or a neighbor that's caring for them. And then, another thing is to schedule a time to come either to the Animal Services Center or to a veterinary clinic to have the cat scanned to see if it has a microchip, which also would be an indication that it was owned. We're in the process of purchasing more chip scanners so that we can expand the reach and be more accessible, have that service be more accessible, so that neighborhood service centers and recreation centers and even some pet stores can help with the scanning of animals and thereby supporting those reunifications with owners. So this graph shows what we've been doing in terms of sterilization, the spay-neuter portion and vaccination portion of the TNVR work with some of our community partners at Animal Services. So this is actually in our in-house clinic with our staff and our operating budget. So during the pandemic, when clinics throughout the area and throughout the country were shut down for 3 to 4 months, maybe even longer in some cases, RAS was actually able to increase its spay neuters for community cats by what amounts to a 600% increase. In addition to these 279 cats that we're able to do in our clinic, we also supported 40 community cats that were done by a partner organization through our Pets for Life program. And then through our involvement with a local coalition, we were instrumental in getting $20,000 allocated to specifically to community cat sterilizations in partner clinics. So other external clinics that we don't have those specific numbers as metrics that we're tracking. But those are all, that's all community cat work that we've been involved with, either doing directly or supporting. And we were able to do this 279 animals in our clinic, largely because of the shift in the industry, really limiting intake to the animals that are most at risk and devoting more individual attention to the animals in our care. So because there were fewer animals coming in, there were fewer animals that needed spay-neuter as pre-adoption candidates, we were able to reallocate both staff and resources to providing community cat surgeries, thereby supporting our community cat partners. A lot of the changes are related to the human animal support services movement, and so we could potentially do a separate work session on that. I'm happy to answer additional questions on that, but the bottom line is that what we're doing for cats is good. It's good for the cats, and in the cases where there's an owner or a caretaker for the animal, it's good for the caretakers too. It's also good for people who don't like cats or don't like nuisances that are caused by cats, because TNVR and return to field are really the only practices that have been demonstrated to stabilize and even reduce populations of cats over time, to reduce nuisance complaints, to reduce the suffering of cats, animals coming into shelters with injuries, reduce animals hit by cars. So I'm happy to share studies on all of those things. Again, bottom line, good for cats, but also we need to stop removing cats from marginalized communities and placing them into what the industry has either deemed most appropriate or better over the years, or just like that's like the reality that we've been living in for throughout the sheltering industry. There's people that care for the cats where they are, and so we want to support those cats staying with the people who care for them instead of transplanting them to people that are other different or better in some way, or perceived better. And this is all about improving services. So as I mentioned, we were able to do more spay neuter for community cats because we had fewer animals coming in. But we're also able to spend more individualized time and attention on the animals that do come in. The shelter environment is less stressful when there's fewer animals here, which also contributes to their well-being and overall health. We're able to do more treatments for animals that come in with medical conditions that we weren't previously able to, and again, to support more positive outcomes. And then, a lot of this is about external facing services and doing what can we do outside the walls of the shelter. So you've heard me talk about our Pets for Life program, and maybe you've read things that I've submitted, sent out on that, publicized on that over the last 5 years or so. Pets for Life was really instrumental in getting us to do more proactive work, door-to-door work, and connecting with people where they are and supporting communities. The Haas movement is expanding on that, and so it's not just the 40 or so Pets for Life communities across the country that are now engaged in that kind of work. It's, as you heard in the video, 400 plus organizations across North America that are doing this. So we're able to provide more veterinary care for people that are facing barriers. They might be pre-existing, like pre-pandemic barriers, systemic barriers, transportation, geography, generational poverty. It's there's a need there to provide services, and it's only grown during the pandemic when many of our private vet clinics are just overburdened and are unable to accept new clients. So we've been able to fill some of that void and provide more preventative and proactive support to our community. Those are the things we want to continue to focus on, making the shelter less of a shelter and more of an animal community animal resource center, a hub for the most at-risk animals, and a resource center for serving the community of people and animals. This is an exciting time in our industry, and one that we're celebrating here. And we ask you to celebrate with us. The work that we're doing, the recognition that we're getting as a leader in a progressive organization that's not just following best practices, but that's actually been invited into the fold and the discussion about leading the evolution of animal services. So happy to take any questions you have about cats in particular, about the human animal support services movement.
So thank you, Chris. My thing here is about education, right? And educating our general public on what you're saying. Because what do you say to all of the critics who are saying, we're refusing cats in your shelter, you're causing a more of a robust negative impact with cats in our community? We've gotten a lot of correspondence, we've gotten a lot of people that have reached out to us around this topic. And so, it's a part two. One is, what more can we do around educating the public on what we're doing best for cats, number one. And I know we always can do more around education. And number two, what do you say to those individuals who say we're not doing a service to the cats in our community?
Just writing them down so I don't forget. Okay, so so we could certainly do more, and I think that's part of it is that that there has been confusion, and frankly I had a plan to get out preemptively and talk about all of these things and about the human animal support services model in the summer, and I decided that that I wanted it to be to be genuine and not be perceived as the city attempting to divert attention away from other issues that were front and center in racial tensions and whatnot. So, I mean, some of that is because I felt like this needed to stand on its own and be recognized as what it is. It was genuine and inherently good things that we were doing, and not have it be some sort of a ploy to divert attention away from other negative things. So, in retrospect, maybe that was a misstep. But regardless, the information was not kept from the public. The press release went out on June 23rd, indicating that we were chosen to participate in human animal support services. And then I continued to correspond with the rescue organizations, particularly the ones that are involved with the coalition, the Greater Rochester Animal Coalition. So continue to discuss what we were doing here and to share shared content, learning, podcasts, webinars, with all of those groups throughout the whole pandemic. So, what more could be done is resuming the plan of trying to get information out to the community, and the community of all of those stakeholders, the general community members and the partner organizations. We're also looking to partner with organizations in other arenas, like human social services partners. So, I mean, we're already starting to reach out and have these discussions with other partner organizations. And I'm working both with the city communications department and with the marketing communications committee for our Friends organization to figure out to develop a communications plan in general for all things that we have, on the horizon, from human animal support services to fundraising events to community vaccination clinics and so on. So there will be more and more information forthcoming. What I can say is that we're increasingly using social media to share the stories about what's happening, and so there'll be stories on a daily basis going out that are related to the different elements of human animal support services, including things about cats that are success stories, cats that have been reunited with their owners, cats that community caretakers have brought to us and then had returned back to their neighborhoods after getting the animal examined and treated here. And all kinds of pet reunification, community-facing vet care stories. So we're working on that, and there will be more and more. Maybe I won't be in studio with the regular media outlets that we usually work with, but perhaps in a forum like this, or through phone interviews, we can also disseminate the information through traditional media. And then our website is an ongoing source of information that we continue to update. I'm one of the content managers, so I do some of the updating to some of our pages myself. But we continue to look at how we can expand the information on there and make it more useful to the community. What do we say to individuals who believe that or insist that we're not doing the right thing, or that we're turning cats away? The other thing I could say to that, Vice President Lightfoot, is that the complaints or concerns that have been brought to my attention are I don't want to put a number on it, but I would say like less than a handful. So when concerns, they go through a process, right? Generally, if someone doesn't like what they're hearing, they ask for a supervisor. The supervisor would be the shelter manager, right? And if they don't like what the shelter manager says, then maybe I hear about it. or they come to you, and then you let me know, and I hear about it. So most of the concerns that have been raised have skipped some steps and gone right to you or gone right to social media. And I don't understand what, why or what's happened. And many of the concerns that you're receiving and that were shared at a recent public meeting speak to council session were from individuals from one particular organization. And that's an organization that we've worked with for 20 years. And that's been a partner organization that I could still consider a partner organization that we had correspondence with. I met with that organization and probably 10 other reps from 10 other groups in July to talk about similar concerns. And we had ongoing back and forth emails, correspondence into September, where we were communicating with them, offering support, sharing resources, and at some point it stopped, and all of my emails have gone unanswered since September 4th. So, and in spite of that, I've continued to share information both about what we're doing and content that maybe is more readily accessible to me because I'm in the Haas pilot. Well, actually, it's not being called a pilot anymore. I'm in the Haas collaboration, and I'm attending the webinars, and I'm party to all of this information that that's my job. I'm doing this as a full-time job, and our community CAP partners are largely folks that have other jobs and are doing that work on their personal time. It's incredibly valuable work, and we view them as partner organizations. And I'm extending the hand, the olive branch. I really at a loss for explaining why we are here where we are, but it's not for lack of trying. So I guess my point in that is that if there's a concern and it's brought to the supervisor or to my attention, we've resolved those. And so the ones that are coming to you are ones that didn't come to us directly. That's, there may have been confusion about what we were doing. Our staff has been having to deal with, what's happening in our industry, and effective like March 14th last year, we really shifted how we were doing things. And there was a deluge of information, both related to, COVID guidelines, and then what shelter veterinarians were telling us about animals being, could they infect people or not, and then the Haas pilot sprang up in like May and June. So it's just been a whirlwind of information. It's not surprising that community members are confused, because our own staff are confused about the information coming in. And so working to try and clarify with our staff and make sure that we're messaging things correctly has been one of the primary focuses for the last year. And that was something that after meeting with those groups in the summer, that really, I reinforced the message with my team. We addressed, a concern that came up in September. And again, I'm not sure what to say other than, if someone has a concern and they bring the specific concern to us, we're addressing the concerns. And like I said during my presentation, the default option remains intake of the cat. That doesn't mean the cat is automatically going to get placed in an adoptive home, but really trying to have a conversation with folks about what's best for the cat and what's best for the community.
Okay, thank you, Chris. I'm glad to hear that you are addressing some of the concerns that people have brought before us. I'll open it up to the rest of our council members to see if they have any other questions that they may have for you. Okay, if none, then
I'll jump in, Will. I'll jump in with just a question. Sorry.
Councilmember Gruber.
I was trying to make some space for other people. So Chris, I guess what I want to understand is, so you've addressed kind of how some of the miscommunication and how the public experiences these changes when they come in, and ultimately that it sounds to me like what you're saying is we're encouraging and advocating for a particular set of responses, but in the end, the shelter remains there to help people troubleshoot and find the best solutions for these cats. I'm happy to hear that. I guess I know that there's a huge amount of volunteers that go into the work that you do, which is in some ways a little bit odd for a city function, right? City functions don't oftentimes have that many volunteers working with them. I guess I'm just wondering how have the volunteers, I mean, have they all been trained? Have they received an orientation on this? Do you feel like they're well prepared to be able to be the ambassadors of this message? Because that's really what we're hearing, is that right. There's some new changes, some good changes, some exciting changes, but they're big changes and they require really crystal clear communication. Do you feel like you have your volunteers ready to be those ambassadors?
Not yet, but not for lack of trying. You know, I've done 2 town hall meetings with volunteers where the entire contingent was invited, and I think fewer the 30 or fewer attendees at each of those sessions, and with a pool of possibly 150 to 200 volunteers at the onset of the pandemic. So also lots of our volunteers, either we had to stop a lot of the volunteer activities that involved in-person duties where we were trying to limit the number of people at the shelter, so that also included volunteers. Several volunteers have stepped away because of their own desire to isolate during the pandemic and not wanting to risk exposure, whether they were in a particular risk category or not. So those folks unfortunately haven't maybe been as engaged as previously, but all of the information that we're sharing with staff, we're also sharing with volunteers, or most of it, I should say. I mean, if there's a staff specific item, it doesn't necessarily go to all the volunteers, but similar information goes out. We have a volunteer coordinator that assists with making sure that the volunteers are included in correspondences. So there is ongoing work in that arena. We're doing a mixture of inviting existing volunteers back. That's my dog shaking. Back into the fold as opportunities have arisen. So, for instance, dog walkers have been invited back for several months now, because getting the dogs out of the shelters and providing that exercise and enrichment is critical to the well-being of animals. And so that was one of the first things that we were able to resume. But we've started to bring back volunteers in other capacities. But we're also in the process of recruiting and training volunteers in new opportunities. And so those are a mixture of incumbent volunteers who maybe can't come back to do what they were previously doing, but can assist in some other way, or new volunteers that are coming on And there's lots of new opportunities for providing all kinds of supportive services that we didn't have before. And one of the newest changes is we've got a team of I think 6 or more volunteers now that are providing greeting people at the door, providing sort of a first level of triage to what people are seeking in terms of their service. Because one of the concerns we were hearing is that people come up to the door and they see the message on the door and they have to call a phone number, and sometimes they're on hold or waiting for someone to pick up because the 2 people at the front desk are already on the phone or are already engaged with the client, and they can't just step away and go to the door. So we're working on resolving that solution. And I mean, like, that's just an example, but that's kind of how we operate, is that, like, you know, we're trying to be responsive to, you know, what concerns and needs arise and make the adjustments accordingly. So we'll continue to share information. You know, I'll probably be doing another volunteer town hall meeting, and we'll you know, focus on, like, you know, what's happened since the last one. You know, what's changed, what have we implemented, or what's different, and hopefully, you know, continue to get people to engage in those things.
Thanks. That's it for me. I would just, you know, encourage you. It sounds like you're already putting the strategies into place, communications, marketing, and getting volunteers to be the ambassadors of this stuff. I mean, we really did. One of the reasons we called this work session is because I really do believe that we received a greater amount of calls for animals around animal service in a 2-day span than we had certainly in my 3-year, 3.5-year tenure on council. And that, you know, that always is cause for some major questions. So I think you have the strategy down. If we can be supportive at all, I hope you let us know.
Thank you. I appreciate that.
Any other questions from any of our other council members? If none, I want to thank Director Fitzgerald for your time. I thank you for bringing some insight, a little more clarity as to what's going on concerning the cats in our city. We look forward to the more informational sessions. Please keep council informed so we can inform our circles around the different training sessions or informational sessions you may be having with volunteers, and or the educational opportunities around proper housing and or what to do with cats if and when individuals come across stray cats in our city. Please keep us informed on how to engage our community and inform our community around efforts that you guys are doing at the Animal Services. So we wanted to thank you for your presentation today.
You're very welcome. Thank you.
All right, so that's all of our business we have for this work session. I hope everyone have a great evening. Stay safe, protect your circle, continue to wear your mask, and God bless everyone. Bye-bye.
Good night.